So if you've ever had any dental problems ever in your life, you're probably wondering, why is dental work so expensive? So in this video, I'm gonna break down all the reasons and all the factors that play into why dental work can be expensive. So first and foremost, dentistry is not easy, okay? Dental work is difficult. Dentists undergo extensive training and they put in several hours into learning how to do dentistry. And at the end of the day, it is a craft. Just so you know, dental school on average nowadays is anywhere from $500,000 to $750,000. So there's a trickle down effect when it comes to the cost it takes to be a dentist and the prices that are charged. You see, the funny thing is though, is dental treatment pricing has not changed in 20 years. So you may think it's expensive, but can you imagine how it was 20 years ago? Another thing that plays into the cost of dental procedures is the technological advancements that have been happening in the field. I am someone who is very excited about all the advancements that are happening in dentistry, but it comes with a price. So for example, you know that gooey impression tray that they stick into your mouth and you're like gagging on it the whole time? Yeah, not the most comfortable thing. So what's been invented is a digital scanner. And what a scanner does is it takes a bunch of photos of your mouth and then it stitches them together and then it presents a 3D model that can be used to make molds or even be the starting point for night guards, clear liners, bleaching trays, all that stuff. It's so much more effective and it's a lot more accurate too. What's crazy is the cost of these scanners can be anywhere from $10,000 to $30,000. Again, not cheap. There's also a cost that comes with maintaining these scanners. A lot of dentists have to pay a subscription fee to be able to get access to the program and the software that runs the scanners. So if something is going in your mouth, would you want it to be of high quality or low quality? I don't know about you, but I want high quality. And that comes with a price. You see, in the dental industry, materials are made all over the world. And just like anything, stuff that comes from China is usually a lot cheaper. And what does that quality look like? Remains to be seen. Again, dental offices are going to choose to use different materials and that's on them. But there is also a range of quality when it comes to materials in dentistry. And these materials are not cheap. To you, you may just be getting a filling, but the materials that it takes to do a filling, it's quite a laundry list. There's a handpiece that the dentist has to use. There are multiple burrs that the dentist has to use when they're drilling the tooth. There is also a suction, there's cotton rolls, there's gauze, there's an acid etch that helps clean the tooth. There's a bonding agent. The bonding agent may just be a drop and it's a small bottle, but this small bottle can cost hundreds of dollars. There's also the composite material that actually goes into the filling. Then there's the light that makes the filling hard. Those can be a couple $1,000s and you need multiple of them in the office. Then you've got your polishing discs and your polishing cups. Then you even have a paper that helps mark where the bite is to ensure that your filling fits. As you can see, for one simple procedure requires multiple things. And that is just a very basic way to do it. So just remember, something that may seem simple and easy actually may require a lot of steps and a lot of expenses that go with it. And I can tell you this much, the price of doing one filling does not match how much it costs for the materials. This is why a lot of dentists will choose to use cheaper quality materials because the reimbursement rates aren't actually as high as they should be. Filling should be more expensive. The average price of a filling these days is around 220 bucks. And so the cost of these materials go up over time, but the price you can charge a patient, especially one who has insurance, does not. Would you be cool with it if the dentist used the same gloves for every patient in the day? It's kind of gross, right? So another thing that dentists have to pay for are infection control and safety measures. So you're talking all sorts of PPE, which is personal protective equipment, gloves, masks, gowns, all sorts of stuff. And when the pandemic hit, it was crazy. There was a shortage of supplies and everybody needed even more, which totally changed the pricing of PPE. So do you think you can guess what the biggest thing that dentists spend the most money on? Overhead costs. I'm talking about rent, talking about utilities, talking about insurance. I'm talking about the staff salaries and administrative expenses. The thing is you can't cut these expenses because you need people and you need help to run a practice. And that's totally fine. But minimum wage has gone up. People want more money over time as they get better at things. And so as a dental business owner, they want to pay their team and they want to support them. But then when they look at how much they can charge the patient and that number doesn't also go up, it's a huge imbalance. This can make it very stressful from a financial standpoint for dentists out there. Another thing that dentists spend a lot of money on is continuing education. So dentists have to take a certain number of continuing education hours every year to keep their license active. These courses are not cheap. These courses are teaching dentists skills that are going to help them grow and scale their practices and generate more revenue and help more patients. But this is something that they have to pay for because if they don't, they're going to fall behind and then they're going to become dental dinosaurs and they might lose their license. So a continuing education course can be anywhere from $2,000 to $25,000 and they're just paying paying for more education on top of the education that they already got in dental school, which was $500,000 to $750,000. Isn't that insane? By the way, if you're a general dentist watching this video and you want to learn how to do clear aligners, I created a free training program that you can enroll in, and you can watch it and you will learn everything that you need to know how to start doing clear aligners. If you're interested in it, check the description below and I'll see you in there. So something that can play into the role of how much dental procedures can cost plays into the fact on what type of office are you going to. Is it a corporate chain or a private boutique practice? Do they take insurance or do they not? These four things can really dictate how much you're paying for dental work. The thing is though, in dentistry, you get what you pay for. If you want to be cheap and you want to find the best deal on the block, you're probably going to get the dentist who's not as good as the one who's charging double that. At the end of the day, dentistry is a business. Us dentists want to help our patients, but in order to help our patients and provide high quality of care, it requires a lot of money for us to spend in education, in materials, and all the training and everything that we need to be able to provide that high quality of care. So don't get me wrong, we can definitely do it the cheap way. You won't have the nice scanner, you won't have the nice materials, you won't get any advanced treatment, you'll just have the basics. But what that does for a patient is it really diminishes the experience, and it also diminishes the quality of work that they're gonna get. By the way, cheap things usually break over time and don't last as long as nicer things. So yeah, you may pay less now for cheaper dental work, but that's gonna break. And then you're gonna need to get it fixed. And then you're gonna need to get that fixed again, and then again. And so if you would have just maybe paid more for the work the first time and had higher quality product, you won't have to get it fixed as many times in the future. This concept works in almost every other field. At the end of the day, dental work is man-made. Things that are made by man break. Nothing lasts forever. Don't forget that. I hope this video brought some type of value to you and you got a little bit more insight on how much it costs for dentists to do business. Also, I hope you have a little bit better perspective on knowing that you may think dental work is expensive, but there are multiple factors that play into it. And honestly, from the dentist side of the table, a lot of dentists can tell you they're probably not getting paid enough for the work they do. How do we fix this? I don't have the answers for it. Feel free to comment below. Would love to hear your thoughts. I'll see you in the next video.